Town Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Hi again, everyone. Time now for our Thursday Community Service Program. This week with Muenster Memorial Hospital, and the CEO of MMH, Brian Roland, is with us. How are you, sir?
Hey, I am doing great, and I'm excited to be back again. It's hard to believe that it's already been a month, so time flies when you're having fun.
That's right. It really, really does. And October is coming up. We're already halfway through September, which is hard to believe, but October's coming up, and it's been something I've learned over the years being married to someone who works in your industry, and that is the fact April and October are both very busy months. You folks got a lot coming up next month.
We do, and as we look at our game plan being, managing today as we prepare for tomorrow, one of the big things that we do look at is community health. The community health needs. What can we do to support wellness within our community and make our communities healthier? Because obviously, as we move forward in healthcare and with what Medicare's game plan sounds like, since it changes daily, is how do we keep people out of the hospital? How do we keep people out of the clinic? So some of the things that we're working on in our area is, what is our game plan to make people healthier and to work on those projects? So yes, October, very busy month. Obviously, we've got the wonderful flu season coming up. Mm-hmm. We are in the process now, in the month of October, all of our employees at the hospital obviously are required to have flu shots, so we're going to be doing those. We do flu shots this year for the students at Sacred Heart in Muenster ISD, so we're going to be getting that set up and going probably third week in October, I think is what we're shooting for with all that. And, as you look at your community health, it's not just the illnesses and things along those lines you want to look at. Obviously, in October, we're going to be doing the big kickoff for the Ideal Protein, which is our clinic's weight loss and weight management program that Dr. Crow Rodney is going to be overseeing. And it sounds like it's going to be really, really exciting. Everybody that's taken part in the beta program seems to be losing weight and feeling healthy and looking good, and so we're excited to see how that takes off in October, because obviously that's very important also. I think one of the things, and Winston Churchill's got a great quote: "Continuous effort, not strength or intelligence, is the key to unlocking our potential." And one of the things that we've talked about in the past month is respiratory therapy. And I'm really excited about the respiratory therapy program taking off at Muenster. We now have hired 2 respiratory therapists. We are getting the program up and going. We can now see patients and keep patients on the inpatient side with respiratory-related issues, while we could keep some before. Because you didn't have a respiratory therapist, you couldn't bill for the services. And so this is a service that will be self-sustainable as we move forward in the future, and it allows us to create outpatient programs that can help take care of our patients in Muenster, where they don't have to go somewhere else to have breathing treatments and certain things along those lines. So I tell you what, that's one of the things that really excites me about the month of October. And obviously it's perfect timing because of the weather change. Mm-hmm. And that's when we really seem to see a lot of that going on. One of the new things that we're kicking off now is we're doing some work with Sacred Heart School on their athletic training, getting our therapists out to work with some of their athletes to make sure that they're doing okay. That's something new, obviously, that we're going to see how that works this year, and then try to figure out, do we want to expand that program as we move forward? Because again, from a community standpoint, this was something that would be really good for our organization and our community as a whole. Obviously, health screenings are coming up in October. That's when you come and get all your blood drawn and all the other stuff, and That's always an interesting time at the hospital. We get a lot of people, it's very cost effective. You get your results back pretty quick, and it kind of gives you an idea on what you can and can't eat at Christmas, because it'll show you what your cholesterol is. And so we're looking forward to that, the October 20th and 21st. We're going to try, diabetes education. We're working on something, Do Well, Be Well. It's going to be a class that's going to be each Friday in October that we're working on for some diabetes education. So again, it's a ton of things. Kicking off the transitional care management when you leave our facility as an inpatient, monitoring you, making sure that you get to the doctor, making sure that you are getting taken care of to hopefully keep you out of coming back in unless you have to, in a short period of time. And then obviously the chronic care management as we work on these community needs and community health needs, is us talking to you on a monthly basis if you have issues and what can we do, and only bringing you into the clinic and the hospital if it's something that we can't take care of over the phone. And then we always have the Fit Center. Mm-hmm. You want to come and exercise. Now's the time to be thinking about that, because January and February is when the place fills up, when we all do the New Year's resolutions. So we all, we all go through that.
Right.
So it's an October's going to be crazy. And what we really look at, or what I really look at as the CEO and how we run our organization is, unfortunately in the month of August, we had 2 rural hospitals close, the one in Crockett and the one in Trinity, Texas. These are East Texas facilities. Over the last month, we've dealt with Harvey and Irma, which has devastated, our healthcare resources in the state of Texas and Florida. And so those are challenges that we're going to have to help as we continue to move forward. But really for us, in Muenster, in Cook County, in our district, what we have to look at is we need to continue to look at those little things that can make us better, that can build our organization. No, we don't need a cath lab. I don't need to do those type of procedures. But if I can do blood work that will help monitor your heart, have the specialist in my clinic, which now we have Dr. Vissers that will be coming over to our specialty clinic to do orthopedics, to monitor you, to do that preventative. That's the pieces that we need to look at. And a lot of people say, well, if you do too much preventative, they'll never come to your hospital. The idea is we want to keep you out of the hospital, but focus on those outpatient things that we can do to make you to make you healthier in the long run, and to get you to live longer if that's what your game plan is. I mean, really what it boils down to for us is we want to be a voice. We don't want to be an echo. And we want to be the ones out there that are trying to set that standard on, yes, our swing bed program is very important for your needs after you have surgery or a stroke or something along those lines. And that is key and paramount to our business. But that outpatient volume, whether it be outpatient physical therapy, respiratory therapy, lab work, x-rays, all these other things that we can do, that needs to be a primary push as we go forward.
Yeah, because there are always going to be a lot more patients, outpatients than there are inpatients anyway, and that's why you really can't come to rely on that inpatient swing bed program.
That is the truth, because it's hit and miss. Right. I mean, it's up and down, ebb and flow, and if you work on the outpatient, you work on some of these other things, hopefully you can sustain it as you go forward and then keep moving forward. And
isn't it funny, in the hospital business, you need patients in order to survive financially, but you're working not to have patients.
Well, I did have a CEO tell me one time, hospitals are like prisons. Those are the places where you have to have people, but they really, really don't want to be. And so you have to figure out other ways to get them there to make it not feel so bad.
Yeah, well, I tell you what, you guys are doing a great job. Keep up the good work, and I look forward to visiting with you in October, okay?
Awesome. We'll talk soon.
All right, Brian, thank you very much. He is Brian Roland, CEO of Muenster Memorial Hospital. And that'll wrap it up for our program here on this Thursday at Hometown Radio 1580 KGAF.